Hi, how you doing today?
Hi.
I'm here to inform you today about the possible impacts Obamacare may have on your choices for healthcare. I'm Marshall Jacobs. I'm currently enrolled at Kaiser University pursuing an AA degree. And after doing some research on the topic of Obamacare or the Affordable Care Act, ACA, I found that the Affordable Care Act, or ACA, I guess we'll refer to it from here on out, was actually signed into law March 23rd of 2010. This law provides support for reform to improve the access to affordable health care and provides regulations to fight insurance companies on the abuse and overpricing. Today I want to focus on the approximate cost of the ACA on the citizens, and also I want to discuss the benefit of lifting pre-existing condition restrictions. Also, benefits of adding regulations to fight overpricing and abuse of insurance costs. The biggest question I found is what's the deadline and the cost for not having insurance under the ACA? Well, the deadline for not having insurance is March 31st of 2014. If you have not gotten insurance by the end of open enrollment, the only way you can get insurance is through a life event. If none of this takes place, you will accrue a penalty of $95 per adult and $47.50 per child, or 1% of the adjusted gross income. Another question is, what if I can't afford this? Medicaid has been extended to individuals if they make below $15,000 a year, or for families of four making under $31,000 a year. And is this amount of the penalty really what the media made it out to be? The next major question that I found in researching this topic is, what if we already have a pre-existing condition? Is there any way we can get coverage now under the Obamacare provision? And the answer is absolutely. Coverage is now available, and open enrollment actually started October 1st, 2013, and it closes March 31st, 2014. This will provide an opportunity for coverage for individuals when before they were unable to. Restricting this or lifting this restriction will allow citizens to get insurance, and it ultimately will bring the price down for coverage for everyone. And third, that biggest question was, how is the reduction in insurance abuse and overpricing going to affect my total bottom line? If insurance regulations and restrictions were in place, basically the cost could be brought down, because one of the regulations that Obamacare does try to use to impact this is if insurance companies try to increase the rates by 10% or more, experts have to determine if this is reasonable. Also, requiring insurance companies to publicly justify unreasonable rate increases ultimately will enforce and bring a transparency and accountability to this large insurance market. Ultimately, lowering the cost for everyone can make all of the citizens in the United States happy and healthy. And I'm sure at some point you have had to try to call a large insurance company dealing with some type of a coverage dispute, or possibly disputing a charge, or possibly trying to get a referral. And at some point, I'm sure you have asked yourself, man, I wish there was someone that could hold these guys accountable, these large insurance companies. And now there is. The ACA basically is providing a deadline which will provide a penalty for about, let's say, $100 a person at most. What that does is that allows people to get coverage, and also people who were not able to get coverage with pre-existing conditions can get it now. The regulations added to insurance companies on the abuse and overpricing all will bring the cost of total health care down, as versus to driving it up. The overall consensus of the American public, basically, their information is based on information from a biased media. With a little bit of research, anyone can see that the impact of Obamacare will improve healthcare and it will improve the healthcare system. The points we have discussed were the three most popular questions I had found about the topic of Obamacare. And in closing, now that the veil of mystery is lifted on a program that was designed to do nothing but improve our healthcare system, do we feel a little better about Obamacare? And does the penalty for not having insurance and having a little government control, is that really so bad? Or does it seem as unconstitutional as what it would maybe was predetermined by the media? Thank you. Bye-bye.